All right, let's read this article. Senators unveil bipartisan plan to lower drug costs. It comes as some Republicans are working to insert a similar proposal into their party line agenda package. Senators Josh Hawley and Peter Welch are teaming up on bipartisan legislation aimed at lowering drug costs by barring drug companies in the U.S. from charging higher prices than the international average. Hmm. I, so in theory, on like a really surface level analysis, that sounds good. Okay. The one place I'm skeptical is that a large part of why international averages are lower than what we pay is because we essentially um, we subsidize international drug costs. So if we were to say we pay 50% more for all drugs. I know it varies significantly from drug to drug, but let's say we pay 50% for all drugs across the board. And just to make this example easy, then um, if we were to implement a law saying that we have to bring it down to an international average, which would cut our drug costs by 50% and bring it down to the international average, I would imagine that that international average would necessarily rise, and that while we probably would see a reduction in the overall cost, it wouldn't be a full 50% because we are subsidizing the international average drug cost, and that if we no longer are subsidizing it in that kind of way by paying higher prices, then necessarily the average price of everybody else is paying is going to have to go up, which still is overall good for us. Um, but it is not as it's not as clear cut as like we, it's more complicated than it might seem. It's not just we implement a rule to say you have to give us the average price and that's that. There's more analysis to it than that. While their bill is different from what the Trump administration is proposing to help finance the GOP's mega bill of tax cuts and extensions, border security investments, and more, it underscores the cross party and populist interest in cracking down on pharmaceutical companies. The White House is pushing a proposal to reduce spending in Medicaid by aligning what the safety net program pays for drugs with the lower prices paid abroad. In a statement shared first with Politico, Hawley, a Missouri Republican, tied the bipartisan legislation to President Donald Trump's efforts during his first term to link drug prices in the United States to those in other high income nations. This bipartisan legislation would continue to work to end a drug market that favors big pharma, make prescriptions affordable again, and empower Americans to get the care they need, Hawley said. Where congressional Republicans ultimately end up on drug pricing as part of their yet to be finalized policy package remains to be seen. While the White House is pushing what it is calling a most favored nation plan, Speaker Mike Johnson poured cold water on the idea during an interview last week. Howley, meanwhile, is a key vote to watch on the Republicans' sweeping party line bill. And as part of the Senate's debate on that measure, lawmakers will be able to offer unlimited amendments on nearly any proposal. He said that if Republicans want to save money on healthcare costs and reconciliation, this is where to start. Wait, let me see it again. Let me read this paragraph again. Howley, meanwhile, is a key vote to watch on the Republican sweeping party line bill as part of the Senate's debate on the measure, lawmakers will be able to offer unlimited amendments on nearly any proposal. He said that if Republicans want to save money on healthcare costs and reconciliation, this is where to start. Okay. So basically, they're creating this mega bill, and that he's basically like, you guys want to pile in the pork, you guys want to pile in the bad stuff that you can't like get passed through as an individual bill. Now's your chance, like Medicare cuts, right? Medicare cuts, I don't think they could actually get through as a raw bill through the Senate or the House. Maybe. My gut tells me no. But if they sneak it into a much larger bill that has tax cuts and all this other nonsense, it's much harder, much easier for them to sneak it through, much harder for them to stop the whole bill as a result of this one thing. So he's basically saying, use this is an opportunity, guys, use it. Cynically, he's Howley's a hardcore conservative Republican from Missouri. So like, I'm not saying this is like a he's doing a good thing, but he's saying to his teammates, guys, this is a good opportunity. In addition to prohibiting pharmaceutical companies from selling drugs within the United States at a higher price than the international average, it would also impose a penalty if companies violate the prohibition. Big Pharma's price gouging has made that a reality for many Americans, forcing them to pay 4 to 5 times more for the same life saving medications as folks in other countries. It's unacceptable, said Welch, a Vermont Democrat. The legislation would go after the list price of drugs, but most Americans don't pay the list price when getting prescriptions filled. That's because health insurers and pharmacy benefit managers are able to negotiate lower costs. The pharmaceutical industry is expected to fiercely oppose such a move, having previously argued that so called international reference pricing and other similar government price controls would lead to significant barriers to accessing treatment for patients, including longer wait times for medications. That's also possible. A possible result of this, besides a market correction, international market correction, like I mentioned, where the international average price goes up if we were to implement something like this, there is also the possibility that there are various mechanisms by which this could create shortages. Um, and like it said, create people have to go without or have to wait for medications. The Congressional Budget Office found last year that an international reference pricing policy based on prices in several other high-income countries, including Canada, France, and the United Kingdom, would reduce average drug prices in 2031 by more than 5%. It's not as much as I would expect. 5%. I mean, that's significant, certainly, but and it's not targeted. So I wonder how they calculate that 5%, because obviously there's so many different drugs that would be affected by this. And people take drugs at different rates. There's a whole lot more people taking Ozempic, for instance, than there are people taking some super rare genetic disorder, disease that 100 people have or something. So I would speculate that if they were to do this as the way they're describing, it's probably would be a good thing, but it might not be an explicitly good thing. And I think there is a more complicated, nuanced discussion to be had about this, and I think the way that it's implemented would be pretty important. I can see some ways this could go bad, or some ways that there could be some unintended or just bad side effects, and those need to be addressed for this to work properly. Alrighty, let's move on.